Hi, my name is Zev Gershon. I'm a physician as well as an attorney practicing medical malpractice law, specifically concentrating in cerebral palsy cases. Today I'd like to talk about the entity called placental abruption. That occurs when the placenta prematurely separates from the uterine wall. There can be signs of placental abruption that a healthcare provider should look out for, such as bleeding. Obviously, if you have untoward bleeding, that could mean a placental abruption is occurring, or severe abdominal pain. That can also be a sign of placental abruption. Of course, the fetal heart rate monitor can show signs of fetal distress, and that can be a sign that the placenta is abrupting. All these factors a healthcare provider should take into account. Sometimes, though, you don't have the luxury of vaginal bleeding determining there's a placental abruption or severe abdominal pain, because the placenta is abrupting on the posterior side of the uterus. It's a hidden, and blood will not be coming out, and pain will not necessarily be felt. However, there is signs and symptoms still that can be seen on the fetal heart rate monitor. And those can be clues to a healthcare provider that we have something else going on here. And this woman should be paid attention to more carefully than any other person in labor and delivery. And hopefully a delivery occurs before the fetus suffers from distress. Interestingly, some of the signs and symptoms that can cause a placental abruption are well known, such as high blood pressure. That's right, hypertension during pregnancy is a well-known cause of placental abruption. Of course, drugs also can be a cause, and therefore, clearly women who are pregnant should not take drugs that are not under prescription, but as well should inform their physician of any medications they are taking so that their pregnancy can be monitored in a safe manner. The idea is, if you're one of the unlucky folks who have a placental abruption, if you're in the hospital at the time and the healthcare providers are monitoring the fetal heart rate monitor, hopefully a delivery can occur before any damage to the baby occurs.